and Brad, the two most famous physical therapists on the internet.
Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
And together we are the most famous physical therapists on the internet.
Well, in our opinion, of course, Bob.
So as you can see, I'm not only the better looking one, I'm also the taller one of the two.
Say no more, Bob.
All right,
Say
today,
no more.
Brad, we're going to talk about the 6-minute walk test. The purpose of this test is to test somebody's exercise tolerance. Really good for people who have like chronic respiratory disease or heart failure, but they've actually expanded now. They use it on just elderly adults, people who've had total hips or total knees, fibromyalgia, scleroderma, lots of things.
So a 6-minute walk test, they're going to walk for 6 minutes and
Right.
they're going to time it?
And we're going to time it. We're going to
Okay.
see how far they walk. And usually what they suggest is you want to set up 2 cones and you're going to put them 30 meters apart. This is not 30 meters, Brad.
Right.
But just for demonstrative purposes,
Sure.
we thought we'd just show. So and then you're going to count how many times, how many laps they make. So
Okay.
obviously
So
down
you get-
and back would be 60 meters.
Right. So you're going to get a timer and click and have them start walking.
Yep.
Okay.
So very simple to do, but there are some contraindications. If they've had unstable angina, in other words, chest pain, and
Right.
it's not stable. If they've had a heart attack in the previous month.
Right.
If they have high blood pressure of 180 over 100 or above,
Right.
you're not going to want to do it. If their resting heart rate is over 120,
Okay.
you're not going to want
Oh,
to do it.
yeah. So, if there's any unusual concerns health-wise, maybe you should see a doctor or, don't do this if there's concerns.
Yeah, and the test is going to be stopped if the person starts to have chest pain or if they really become short of breath, that's just intolerable. Leg cramps, if they're staggering, if they become sweaty.
Sure.
Or ashen, pale
Right.
looking.
They
all
should
those things.
feel just normal,
Right.
maybe a little fatigued.
The problem is that some of the standards here are a little bit off on the way that people do this, but you always want to have them walk usually at a comfortable pace, not as fast. Don't say walk as fast as you can, just say walk at a usual pace or a comfortable pace.
Sure.
They should wear comfortable shoes. As far as encouragement, if you're doing the test, you want to make sure you give the same amount of encouragement each time you test, because encouragement does help people go further.
The motivation,
Yeah, you might want to say nothing at all.
Right.
I mean, that might be the best of all. Sometimes people even do a practice trial
Sure.
of this.
So if you're going to do it from one time to another, doing it in the same location, same atmosphere,
Right.
same shoes.
So Brad, as you start doing it,
Okay.
you're going to go ahead and start, and you're walking down. If he should get tired, he can do one of 2 things. He can either lean against the wall, which we don't have any wall here, or he can actually sit down if he gets tired.
So I could
Oh.
lean against something of this. So this is, then the clock keeps going?
Yep, the clock keeps going, so this is working against you. As you're obviously not going to get as much time down if you're...
You get rested up and you get up and go
Right,
again?
when you're ready to go again.
Okay.
So it's a very simple test to apply. It's very helpful. There are some standards, there are some results, but they all kind of vary a little bit. And they have them for like people who have COPD, what normal results are.
Sure.
They have them for people who are regular, just healthy adults.
Sure.
But the biggest thing, the only thing that they all seem to agree upon is that for improvement is what you want to see is at least 50 meters. So if you test the first time and then you test a month later, you'd like to see that they've improved at least 50 meters. That's a significant improvement.
Okay.
So
All
I'm
right.
not going to give any of the other numbers. You can look them up online.
Right.
And there's just a lot of them.
Basically, you're looking for either a change, better or worse. They're going to do something maybe 4 weeks later. They're going to exercise,
Right.
change your diet, change medication, whatever, and then test it again.
And then you're going to see, it's a motivator too, that you can see that you're going actually further, each time is what you
Right,
like to see.
exactly.
And, these testing has been even used to determine whether or not they think someone is maybe going to be hospitalized. Like I know in one case, people with COPD, if they went less than 200 meters, there's a good chance they're going to be hospitalized
Sure.
soon. So the test can be used for a lot of things like that.
Right.
So,
Okay.
all right.
All right. Can it test for a broken heart, Bob?
Yep, that's right. We can fix just about anything, but we can't fix.
A broken heart, and I don't think this test is going to help us.
No, we're getting
even
closer.
break one.
We're zooming in on it.
Yeah,
now,
it is.
so.
Yeah.
All right.
We're gonna do it.
Thanks for watching.